You might have seen the protest today at West Middlesex Hospital in London, or you might have seen the online protest with hashtags like Save Carla's Life and Expose Emmy Now, and you might be thinking, what's going on? Why are people protesting against a hospital? Well, the protest is about a woman named Carla. Carla is severely ill with myalgic encephalomyelitis, ME. She's a patient at West Middlesex Hospital in London, but the doctors there don't understand her illness, and as a result of that, she's being mistreated. Now, I don't know Carla, and I can't tell you about her particular situation, but I can talk to you about how people with severe ME are routinely harmed and mistreated in UK hospitals. People with severe ME can be very sensitive to noise and light and odors. They really need to be in a dark, quiet room, but hospitals don't recognize this. So patients are exposed to a lot of bright lights and a lot of noise at all hours of the day and night. This makes the patient sicker. It not only causes extreme pain, but it also leads to relapse and deterioration, which can have very long-term effects. So this is one way in which the hospitals are harming patients with severe ME. It's incredibly painful and it's incredibly dangerous. Another way that patients are harmed is the failure to provide nutrition. People with severe ME often can't eat and they need tube feeding. Sometimes hospitals simply don't believe that the patient can't eat and they fail to provide tube feeding. Another way that patients are harmed is sectioning. This is horrifying, but it's actually very common. Because doctors and nurses don't really know anything about severe ME, when they see a patient with severe ME, they simply don't believe the person is really that sick. So they think it must be a mental health problem, and so they section the person under the Mental Health Act. It's barbaric, it's cruel, it's unbelievable, but it happens all the time. These are just a few examples. There are many, many, many more ways in which hospitals harm patients with severe ME. The doctors and nurses and other healthcare practitioners involved are not bad people. They're not being deliberately cruel, but they are ignorant, and this is not acceptable. So how could this happen? How did we get there? How could this be happening in 2024? In my opinion, there are 5 reasons why this harm and mistreatment of patients with severe ME happens in the UK, and I'm going to give you my 5 reasons. Reason number 1 is poor medical education. Many medical schools don't teach ME at all, and the medical schools that do teach ME often give out of date and incorrect information. Doctors don't know anything about ME simply because they haven't been taught. Reason number 2 is poor awareness of the NICE guidelines. The 2021 NICE guidelines, NICE is the National Institute of Health and Care Excellence. The 2021 NICE guidelines tell healthcare professionals how they should treat patients with ME, including severe ME. But most doctors are simply not aware of the NICE guidelines. They haven't read the NICE guidelines and they don't follow the NICE guidelines. Number 3 for the mistreatment of patients with severe ME in hospitals is that hospitals lack a guideline or protocol for severe ME. When a hospital gets a patient who's had a stroke or a heart attack or a spinal injury or anything else, they have a protocol, they have a plan for how they're going to deal with that patient. But when it comes to severe ME, they don't have a protocol or a guide or a plan or anything like that. So the doctors just have to sort of make it up as they go along. And this is one of the reasons why we end up with this terrible mistreatment of patients with severe ME. Reason number 4 is the failure to listen to experts. The UK has some of the world's top experts in ME, and I'm going to name 2 of them. Dr. William Weir and Dr. Nigel Spite are both internationally recognized top experts on ME. And the funny thing is that they are often called to advise hospitals on ME, but they are rarely listened to. And the reason they're not listened to is because they don't work for the NHS. And the reason they don't work for the NHS is that the NHS does not hire doctors who specialize in ME. So the NHS is caught in this bizarre catch-22. They don't hire experts, but they don't listen to people who they don't hire, and therefore they can't listen to the experts. It's bizarre, but that's what happens. Reason number 5, the final reason for the terrible mistreatment of patients with severe ME in hospital, is failure of medical leadership. If the GMC or the NHS leadership or the Royal College of Physicians wanted to stop this terrible mistreatment of patients with severe ME, they could very easily. But medical leaders don't seem to be interested in stopping the cruel and barbaric mistreatment of people with severe ME. So those are my 5 reasons. Thank you for listening to this video. The final thing I would like to say, in case there's any healthcare practitioners watching this, is even though this is chronically ill patients protesting against a hospital, I don't want it to be patients against healthcare practitioners. I don't think we should be against each other. I think we should be on the same side. I personally support the NHS. In the next election, I'm going to vote for whichever party I think will do a good job of supporting the NHS, and that includes paying doctors and nurses properly. I agree with the junior doctors' pay demands. I think they're very, very reasonable. I understand that people working in hospitals right now are incredibly overworked and incredibly busy, and they have incredibly difficult jobs, and I don't want those people to feel attacked. But at the same time, what's happening here, it really does need to change. I support the NHS, and people with ME in general, I think we do support the NHS. We need NHS workers to support us. Thank you for watching.